When we look at the research, back pain afflicts somewhere between 1% to 94% of all athletes. Yes, you heard me correctly, 1% to 94% of all athletes. I say that with a little bit of a smirk because the research out there is so conflicting. That kind of shows us the errors and how flawed some of our research actually is. You look at different studies and they pretty much all come to one agreement, being that back pain is a problem for athletes and it's very prevalent. But the exact numbers of who has it, when they have it, what sports are at the most increased risk for it, there's not a coherent agreement between all the research. The primary take-homes we can get from looking at the research is this. A lot of athletes have back pain. It's caused from repetitive loads, especially into flexion, extension, and rotation. Sports that involve those motions have the highest risk of injury or low back pain prevalence. Another risk factor associated with low back pain is training volume and training load. So how much the athlete is actually training and how much load they're actually putting on their spine. So that can mean load or stress from something like plyometrics, jumping, impact, but also weightlifting or sport-specific drills. There's not a statistical difference between males or females in the prevalence of low back pain in athletes. And this is a major issue for a lot of athletes that needs to be addressed. Hi, my name's Ryan Tisdale. I'm a doctor of physical therapy, a board-certified sports specialist, and a strength and conditioning specialist. My wife and I own a physical therapy and training facility here in Novi, Michigan, and we are creating a little webinar for you guys on eliminating back pain in athletes. Now, as an athlete myself, I experienced back pain for a number of years when I was playing college football. I know my wife has experienced back pain. She was a competitive gymnast and also a heptathlete in college. This is a problem that afflicts so many of our athletes, but it's an area of sports medicine that is not as glamorous as, let's say, ACL rehab or rehabbing a labral repair or something along those lines. So I felt it was important we start getting a little bit more discussion on it and empower people like you, people who are athletes, weekend warriors, wherever you are in your athletic endeavors, to help educate you on what you're dealing with and how you can manage it yourself. So what we're going to talk through is differential diagnosis, so some of the primary pathologies out there causing back pain, how we go through an exam, how we tweeze out what we think the issue is, and more so, how we tweeze out what the root cause of the pathology is. Not just what it is, but why do you have that? That is the most important thing, and I think that is what distinguishes a sports physical therapist from other sports medicine professionals, is we try to get down to the root origin of your problem, not necessarily what your problem is, but what is causing that. If we can identify that issue, we can help you resolve your issue and actually eliminate your back pain for good. Stay tuned as we progress into the pathology behind low back pain. Okay, before we proceed on with this little webinar, I want to do a brief crash course in some basic anatomy for those of you I would consider lay people or non-medical professionals. There's really three regions of the spine that we need to be aware of. So we have our lumbar spine, which is our primary area of focus. That's what people call the low back. We have our thoracic spine, so kind of our mid-back. We have 12 segments there. So extending up just above the lumbar spine all the way up to the base of our cervical spine. A quick way to locate these is just looking where your 12th rib is. That's your 12th thoracic vertebra. And looking where your first rib is, that's your first thoracic vertebra. If we zoom in a little bit more, we have 7 cervical vertebrae up above that until we get to the base of the skull. Again, for the purposes of this webinar, our primary area of focus is going to be on the lumbar spine. So that's where we're going to zoom in here. Now, as we take a closer look at the lumbar spine, we see it is intimately related to the pelvis and hips just because of the proximity here. So this bone here, we have your sacrum. This thing I'm circling around on each side, that's what we call your innominence. So your innominence is a pelvic bone. Each one of these innominants has 3 different regions to it. It is not necessarily important for what we're going to be discussing today. And here's your coccyx. It's an attachment point for pelvic floor musculature. As we take this spine and turn it sideways, we're going to zoom in here. We can kind of appreciate some other parts of the spine here. So we have our vertebral bodies. These are these big circular cylindrical, I don't know if that's how you say it, cylinder type shaped objects here. We have our spinous processes. These are these like spike-like things coming out the back, almost like dinosaur spikes. Here we have your facet joints, okay, or facets. This is really where the joints of the vertebral bodies, the joints of the spine intersect. This is where we get some weight bearing through and some load, in addition to through the vertebral bodies. The vertebral bodies should take the majority of the load. We get into issues when these facet joints start taking on more than they should, specifically for areas like our pars interarticularis. So where I'm going through with my mouse right now, I'll make a little mark there. Let's see, here's that pars interarticularis. As we start to talk about pathology, that's an important spot there to be aware of. So we have our superior, inferior articular processes. So that's these guys again. They kind of house the facets. We're going to turn the spine a little bit more sideways. So we have our inferior and superior vertebral notches as a whole. They make up this little circular hole here. That is our intervertebral foramen. That's where our nerve roots exit. So I'm going to draw a little circle in there so you guys can see. Right through there, that's where the nerves come out. That's a pretty important spot, especially when we're talking about radiculopathies or pinched nerve roots, bulging discs. That's not a big space, and we can get some bone spurring and other things in there that encroach on those nerve roots and cause a lot of issues. Those are really the primary points that we need to be aware of as we're moving through in this discussion. Another spot we just want to be aware of is what we call the lamina. So if we're coming off the spinous process, your lamina is going to be this area right here that I'm kind of drawing in. If you've heard of a laminectomy, that's the portion they're kind of cutting through to remove when we're talking about discectomies or stenosis and some other things. Don't worry, you don't need to know everything. You don't need to be an expert right now. I will pop this little video back up and talk through some more anatomy as we're going. Just wanted to give you a quick introduction to some of these regions and areas we're going to be talking about. Thanks for checking out the sneak peek to our webinar on eliminating back pain in athletes. If you'd like to see more, please reach out to us directly, shoot us an email, shoot us a phone call. We can send you a link to the full webinar. It's roughly an hour in length, but there's a lot of great content in there, some self-help techniques, and explaining why we address the root origin of your problem and how we get about doing that.